Now, occasionally there is a patient who obviously conservative treatment isn't necessarily working and they're looking for an opinion, and that opinion they'll go to as a surgeon, and they'll often say to me, do you know of a good surgeon? Now, this makes sense that you think a good surgeon means more likelihood of good outcome or more able to predict if surgery is the right approach and therefore a good outcome. What was interesting, there was some research done on this, and it was quite an interesting piece of research because they looked at surgeons predicting whether or not there was going to be a good outcome after surgery, before surgery. And the surgery they were looking at was a partial arthroscopic meniscectomy of the knee, which is basically trimming up a bit of the cartilage, taking a little bit of the damaged area out of the knee arthroscopically with keyhole surgery, commonly done with professional footballers and such like athletes. So you would assume that, surgeons would be pretty good at looking at a patient and going, yep, I think this is a candidate for surgery because we think this is going to be a good outcome. That's obviously one of the main reasons to understand whether or not to go forward with surgery or to not go forward with surgery. The other thing that patients obviously are asking me about is, do I know of a good surgeon, an experienced surgeon? And this research looked at the comparison of inexperienced to experienced surgeons and seeing if there was a difference between the two groups with predicting the outcome. So the first thing they were looking at was how often they were predicting a good outcome, and what they found is it was 50%, so basically as good as tossing a coin, which basically means no level of ability to predict, it's just fluke basically, which firstly is very interesting because then it means that you're just rolling a dice. Well, you're tossing a coin in terms of, are you going to have a good outcome or not? So predicting it is actually not very effective. Then the other interesting one is they did a comparison between the two, like I said, the experienced versus the inexperienced surgeons, and found zero difference between the ability of predicting or not predicting an outcome. So this highlights that when patients say to me, do I know of a good surgeon? Maybe it doesn't matter. And obviously with surgery, if you go to a surgeon and ask the opinion, is surgery going to work? You might as well toss a coin, according to this research. So it is very interesting that we have this very strong belief that experienced surgeons are going to be better, and that would make common sense. And we are going to assume that they're going to be able to tell us, is this the right approach? Is this going to work? Well, this is also no different in physio. Patients will say, will I get better? Is this going to work? And the reality is the human body is varied and not textbook. It's a very grey area, and therefore things can't be predicted with the human body, unfortunately. We'd love to have that black and white yes, no, but what this shows is surgeons, physios, whoever, they can't necessarily predict the outcome. They could quote research and say there is this chance, but we can't be definitive with the individual at hand. But it was very interesting because I do get asked that question from certain people, what surgery should I have? What surgeon should I see? Is there a good surgeon you recommend? And what this highlights is maybe this is irrelevant really, which is very interesting. Anyway, that's it for this video, and I'll see you next time.